Kia ora again, everyone. I'm Hamish Wilson, and this is the first demonstration in this suite about consulting with patients with persistent physical symptoms, or PPS. Today we're focusing on how to use the physiology of the sympathetic nervous system, or SNS, to explain many of these common symptoms. I'm going to consult again now with Mrs. Jane Smith, who's just been investigated for hypertension with the usual screening tests and 24-hour blood pressure monitoring. I think she's coming back today to talk about the results. So as outlined in Chapter 4 on the ever-present SNS in the handbook, the explanation today will focus on how this alarm system can contribute to intermittent bouts of symptoms, noting that the explanation I'm offering will be quite generic, regardless of which organ system might be involved. A couple of points before we start. These are physiological problems rather than coming from biomedical or organ-based pathologies. Secondly, they are involuntary responses of the body. They arise because of the way we are wired, and that goes back many thousands of years. It's the subconscious parts of the brain that are programmed to alert us to danger and to try and keep us safe. And sometimes it does that a bit too well. Over time, however, we could have some conscious influence on how the body reacts. So I'll be roughly keeping to our recommended format in the consultation skills chapter in the handbook, which is firstly establishing what the problems are and hearing Jane's perspective. Clinically, we use the standard approach of differential diagnosis and then an explanation for what might be happening, then provide some ideas for what the patient might do from now on. Kia ora, Jane. Nice to see you again.
Hi, Hamish. Hi.
Yeah. And you've come back to talk about blood pressure, I understand. Is that right?
Yeah, the nurse just took my blood pressure before I walked in. She had time, and so it's just almost through the roof again. It's really high.
Oh, okay. Yeah.
Yeah.
And you're back at school again this year? You're teaching?
Oh, yeah. The term has started, and it's been really intense, really full on. But lovely to be back. The young people are just so gorgeous.
Fantastic. Okay.
Yeah.
So we've got to focus on your blood pressure today?
Yes.
Yeah. Anything else you want to talk about?
No, I'm good. Blood pressure, sorting this would be really helpful because I'm beginning to worry.
Well, I remember we chatted a few months ago and I sent you off to the specialist for 24-hour monitoring. Is that right?
Yeah.
You've had all that, and actually I've got the results here now.
Oh, do you? Okay.
Yeah, and they're really good. So your blood pressure wasn't up very much during the day at all, and at night it dropped down to your boots, so we can say that you don't have what's called essential hypertension. You don't have that. All those other tests came back normal as well.
Sorry, I can't help being surprised.
Yeah, well, it's good news, but...
Yes, it is lovely news. However, there's a discrepancy between what some other measurements that's been really, really high just right now.
Yeah, I know. Did the nurse say what it was this time? Actually, I've got it on the computer.
Yeah, she might have sent it through, but she said, wow, that's really high.
Yeah, a little bit up.
And I thought, oh, here we go again.
Yeah.
So,
well, let's try and figure out some way to explain all this, eh?
Yes, please. Yeah, that would be great.
Okay. Is anybody else, before I do that, is anybody else in the family with blood pressure?
Oh, yes. Yes, my dad. He was prescribed statins in his mid-50s.
With some blood pressure medications, was it?
Blood pressure medications. So he's in his 70s. He's doing well, but he's taking that medication.
Sure.
And my grandmother was a little girl. She had a stroke and then ended up in a wheelchair.
Oh, okay.
Yeah, I remember her.
Do you know what the cause for her stroke was?
Yeah, hypertension.
Blood pressure was. Oh, okay, yeah.
This is my father's mother.
Your father's mother. So there's in the family. So it would be fair enough for you to be worrying about blood pressure.
Yep.
Yeah.
Yeah.
But when we do the 24-hour test, it comes back okay.
Right.
So what that adds up to probably is this thing called white coat hypertension, which is blood pressure that only goes up in certain circumstances, like seeing the doctor.
Okay.
And that's not so uncommon as it turns out. A lot of people, when we go to the doctor, you're not that fussed about it, and we're a bit worried about, having blood pressure and it goes up. It's more like an expectation than anything else. It's a bit like maybe going to the dentist and expecting it to hurt, and unfortunately it does.
So it's something up here.
Well, no, not really. It's not, well, it's sort of up there, but not really up there, if I could try and explain. What it is, I think, is your alarm system, your internal alarm system in the body firing off.
Right.
And have you heard of the fight, flight, freeze alarm system? That's the one that, the one that...
Survival.
Yeah, well, it doesn't take much for us to fire that up. Someone crosses into your lane when you're driving to work, and your alarm system will go off, which is quite a good thing, because we have to be ready for danger in our lives and so on. And so the alarm system it's quite interesting. It sort of fires up some parts of the body more and sort of reduces other parts of the body. So the blood pressure and circulation and breathing and muscles get ready for action. So more blood supply to all those.
To run, really, isn't it? Yeah, okay.
And then the other parts of the body that aren't so necessary for immediate survival, like, digestion and immune system and the skin and so on, they sort of get down, but less blood supply, or called down-regulated. So they're not, they're on standby sort of thing. So you're ready for action.
Digestion.
Eh?
Digestion, you say?
Digestion's not needed for running, so that gets sort of put on hold.
Interesting. Okay.
You touched your tummy there. What's?
Yeah, I'm just sometimes I have a bit of puku ache.
Oh, do you?
Just the other day, we've been all of last year, we've been trying to resolve this issue with the staff and the headmaster, and so just starting the year, we had another meeting and discussion, and still unresolved. And
oh, okay. And what you?
Yeah, and I just noticed.
You feel it in your tummy.
It was just spicy feeling in there,
churning away.
Yeah, and just not. Yeah.
Well, so I didn't know you had those symptoms. So is that you've had those for a while, have you, in certain circumstances?
Yeah, actually, now you're asking, it's. Yeah, on and off I do.
How many years?
I mean, I noticed really after that conversation, I was just
with that
frustrated, and it didn't work out again. So we're still working on it, and and I noticed this really irritation, almost anger.
Oh, okay.
Yeah, in the puku area.
Okay, well that's interesting. Have you ever been investigated for those sorts of symptoms?
No, because it goes away.
Comes and goes.
Maximum a day or so.
Oh, okay.
Yeah. So I thought...
You're not too worried about that?
No.
But it sounds like some sort of trigger happening in your work life can trigger off that sort of symptoms.
Yeah, maybe. Yeah.
Well, it's possible that's linked to the way that, the sympathetic nervous system is firing up. And if your digestive system was on hold, then all the coordination of your, the bowel peristalsis and all that sort of stuff wouldn't be so well coordinated, and you could get symptoms from that. It sounds like a sort of a relative of irritable bowel.
Yeah.
Which you might have heard of that phrase.
Yeah, maybe. I never thought of it that way, because it just passes really. I mean, as it comes, it's gone, kind of thing.
Oh,
It doesn't linger long.
Long enough. I take it you've got no what we call red flags. You've got no blood in the bowel or anything like that.
No, I haven't noticed.
Okay.
Yeah.
Yeah. Well, I need to do some more discussion with you about that, but it's possible that that's related to the firing up of the sympathetic nervous system as well. This all happens at an unconscious sort of level. I like to think of as a little wee person in the control room of the body, which is below our consciousness.
Right.
We've got a conscious bit and an unconscious bit. Unfortunately, we have that because when we fall asleep, but otherwise, things wouldn't work. We stay alive at night, fortunately.
Okay.
So there's a little person, I like to think there's a little person there, and they're controlling everything.
Okay.
And they also control the alarm system.
Right.
So it doesn't take much for the alarm to go off, and then our body, heart and lungs and muscles get a bit too fired up, and then the other systems get lowered down, and then you can get symptoms from either of those.
Okay.
What about, have you had any other symptoms in your body that you're curious about?
Well, I sometimes notice, but everyone gets that really. I mean, I sometimes notice a bit of like, it feels like tension, headache. I've looked it up on Dr. Google.
Yeah, good.
Yeah, so it's really after a long day at school and some stuff going on at home, maybe with my own teenagers, and maybe having had another discussion with the headmaster. So I notice, there's tension in the neck and around here, and it feels like a tight hat, and eventually it goes away again once I go for my little walk, or
You've had those for years, I take it.
Yeah, so and I suppose everyone gets them on and off, so I haven't been taking them too seriously or worrying about them because they don't linger.
Yeah.
Again.
And you recognise those as being tension headaches.
I think so.
Yeah, when you looked it up, it seemed to match what you saw.
Yeah.
And you got no other symptoms in terms of your head or balance or
balance is good, I believe. Vision, I feel is still all right.
And it comes and goes, does it?
Yeah, vision is good, yeah.
Okay, so these sorts of symptoms, tummy ones and headaches, do you ever get those when you're on holiday?
Actually, now I'm thinking about it, no, I have not noticed that.
But you notice that there's often a trigger.
I've never thought of it like that, but yeah, okay.
There's a trigger sometimes, and you can see the pattern yourself, can you?
Yes, now I can.
Yeah, so that would work quite well, wouldn't it, for, muscles being a bit too tight as part of the sympathetic nervous system again, muscles being a bit too tight, and then I get headaches. I get these little trigger points in here and back here, and where the muscles join on to the bones of the head and stuff like that.
Yeah.
And that's pretty common, really. It's quite a consistent pattern that people have.
It's a relief.
Yeah.
Again, I must say.
Well, that's explainable under this system, sympathetic nervous system. Okay, I just want to try and explain all this, if I could, a bit more.
That would be great.
Yeah, okay. So have you ever, can you remember a time where you got a sudden, real big fright?
Oh, yeah. Yeah, when our little one was getting a little bit too close to the wharf out at Port Chalmers, and I thought my husband had her, and he didn't, and we thought she would fall, and there was a huge fright.
Really scary.
Really scary. Yeah. And she could actually swim, but it's like you hear just terrible stories.
Do you remember the feeling in your body with it?
Oh, just like it felt like my heart was jumping out of my chest, and it felt, and all I wanted to do was just run and rescue her. I mean, she was fine. She ended up being fine. She was just, literally toddling around there. Yeah, sure. And but the fright, wow.
The fright, So I've got this little diagram here, which I can show you, which is the two things in the body: the fight, flight, freeze system.
Yeah.
And also the other side is the rest and digest parasympathetic system.
Yeah.
And these are really helpful because this is always in balance. So that fright, it was a very good, what you talked about was a good kind of illustration of how the body reacts to that sort of danger.
Yeah.
And then you found your daughter was safe, and your body calms down. That's through the parasympathetic system.
Took a while though.
It does take a while.
But still,
Yeah. But that system is designed. So there's another diagram. I'm quite big on diagrams.
Okay.
Here's another little diagram. This is the sort of seesaw balance between the sympathetic and the parasympathetic.
Yeah.
And when you get the fright, one goes up and the other goes down. And then the fright goes away and the other one comes up again. So the idea is we're supposed to rebalance ourselves the whole time. And it doesn't take much in modern life for your sympathetic system to be fired up.
No.
At school, having teenagers,
World news.
enough to fire us all up. So what's missing in that is, the seesaw is mostly often inclined up more to the sympathetic.
Yeah.
And so we've got to find ways to calm down, and we do that through trying to enhance the parasympathetic or the rest and digest and heal system, it's called.
Right. Because the snake is not, there aren't even snakes in New Zealand, and it's just on your diagram, lovely. But just to remind ourselves that there is no snake.
No, there isn't.
Not always.
Well, let's go back to your blood pressure when you see the doctor.
Okay.
Taken by the nurse. So it's possible that your memory of your grandmother perhaps is saying, well, this is danger. If I have blood pressure like my grandmother,
that's the snake in my mind.
That could be the snake in your mind.
Okay.
So that's fires, and in this case, it's pretty selective. It just fires up your blood pressure. Even though I imagine you're probably feeling quite relaxed at the time, you're just getting your blood pressure. So you're feeling okay, but your internal body system is firing up that blood pressure, and then whammo, it comes back high, and then you see that, and then whammo again. Oh dear, that's high. So everything.
I just remember that feeling as a child. I was quite young, and I remember parents and my older siblings being just really, really upset and worried, and so many things were different. We were eating differently. We were constantly driving to the hospital to visit her, and she was in this wheelchair that really got to me. So
being in a wheelchair.
My grandmother, she was sitting in a wheelchair, and
after the stroke.
Yeah, after the stroke, and I remember, thinking, Granny can't walk anymore.
Right.
And she's in hospital, and so it was a stressful time in the family.
Yeah, so it's quite a strong image for you then, isn't it?
Yeah.
So, I mean, I'm just trying to explain this, but us humans, we don't really like to think that we have conditioned responses, like the Pavlov's dogs, and we think we're above that. But actually, our internal body systems are a bit like that. So any trigger about blood pressure means danger. Getting your blood pressure taken as a trigger, blood pressure goes up, unfortunately.
Yeah. Okay.
But what I can say is you don't have blood pressure. You only have blood pressure for 10 minutes out of 24 hours, and that doesn't cause long-term problems. You don't have essential hypertension. You're not going to have a stroke like your grandmother. You don't need medications, none of that.
I love hearing that. It's a great relief. Okay, so how can we keep the blood pressure down?
That sort of makes sense for you, is it?
Totally.
As to why you've got high white coat hypertension or white coat blood pressure.
I'll work on it. Is there a way to work on it?
Oh, well, good question. I mean, what do you do for relaxing yourself?
I do like going for a walk barefoot in my garden.
Oh, yeah, do you?
Yeah, it's quite nice, but I don't always have time for it, especially in the morning as you're walking.
What is it about being barefoot that's so good?
I don't know. I love feeling the grass or the dew or the raindrops on my feet. It kind of cools me. It connects me to earth. I really like that. But I've just actually this year just started taking yoga lessons. Yeah.
Well, I'm just thinking,
I like how it feels afterwards, actually.
with yoga.
Yeah.
So I'm just thinking, when you have that sensation, like very grounding to have your bare feet on the ground. It's a lovely phrase, isn't it? Grounding.
Yeah.
When you have that sensation, or after yoga, which you quite like that, how does that sensation in your body compare to when you're getting your blood pressure taken?
Yeah. Okay. Yeah. I feel a lot more at home when I've done yoga.
Yeah.
I mean, I'm still a beginner. I have, I just started. But yeah, I feel a lot more at home, and I feel a lot more settled. And everything is working together the way it might, it's supposed to.
Sounds fairly more grounded, I suppose.
Yeah.
And I imagine at that point you've got your parasympathetic system.
Yeah, that's what we do at the very end of yoga class, this lying down and resting.
Oh, okay.
Yeah. They call it corpse pose for resting.
Charming.
Yeah. Well, it's just nothing is happening. We're just observing.
Do you do breathing sort of things when you're doing that?
Yeah, I'm still learning that, but there seems to be a huge ocean of knowledge about breathing there. I'm keen to tap into that.
Well, that's interesting because the breathing, they do say that every time we breathe in, it's a bit sympathetic nervous system activating, and every time we breathe out, it's parasympathetic nervous system activating.
Yeah.
Have you heard of that?
Well, it makes sense.
Well, it makes sense.
Yeah.
So one thing I do with my patients is to do the tummy breathing or puku breathing. So you have your hand on your tummy here like that.
Okay.
And when you're breathing, the idea is to try and see if I can do it, breathe from the tummy rather than from the chest. Of course, the breath starts in the chest, but so you're breathing so slowly and quietly that your tummy moves rather than your chest moving. And that's called diaphragmatic breathing or abdominal breathing or balanced breathing or any of those phrases.
Yeah, I feel them both moving, but just allowing the breath to actually fall down into the puku is helpful. Yeah.
So I'm thinking about your three symptoms that you've got. You've got the specific symptom of raised blood pressure when you get it taken. I don't know if this will work or not, but maybe if you tried to have the same sensation after walking in the grass with your bare feet or after yoga, or after maybe a hot bath, that relaxed sensation, the parasympathetic sensation. If you had that prior to the blood pressure, it might make a difference.
So it's actually tapping into that memory of feeling relaxed.
Well, I guess it's a bit like those people who can't go into a lift or they get claustrophobia, or people who can't fly an airplane. Yeah. They sort of do progressive desensitization exercises to try and to find a way to do that without firing off their nervous systems. So these exercises, what you're doing like for with yoga and stuff, they would also be helpful for your tummy flare-ups you get and your headaches.
Makes sense.
Doesn't fix them straight away, but generally the idea is to try and get your resting state more towards parasympathetic rather than having. I mean, a lot of us, I think, we've got a lot on our plates. The seesaw is a bit more upwards and a bit more fired up
than it should be, maybe.
Than it should be, yeah.
I'll actually talk to my yoga teacher.
Yeah.
And ask her whether she might be able to teach me some things.
Yeah, well, there's lots of things you can do. I mean, there's a whole list of things you can do to activate the parasympathetic nervous system. And I just ask people,
I do that. Yeah, the walking and the grass. Yeah.
People just need to look that up themselves and find a way that suits for them. Because you're trying to down-regulate the sympathetic system and you're trying to up-regulate the parasympathetic. And over time, that tends to help people reduce their symptoms.
I mean, we're basically trying to teach the kids at school.
Oh, yeah?
Self-care.
Well, that's
kind of, yeah. But then I've got to walk the talk, don't I?
Well, I mean, it's your unconscious little person and the brain doing this.
Makes all so much sense. I mean, yeah.
Yeah, and it's not, we don't do this voluntarily. You don't walk in voluntarily and create blood pressure.
No, of course
you can't do that. It's all happening at an unconscious level. So the more you understand all that and the more you work on it, the more it'll probably have. I mean, the main thing I think for you is that you don't have blood pressure. You can kind of relax on that.
That's so good. And I'm really relieved.
That would just take away the worry about it, because I imagine in the background you've been worrying about that for some time.
Yeah, I probably was. Wow, that's a relief. I'll go and talk to my yoga teacher about more breathing exercises.
Yeah, and if you come back and get your blood pressure again, don't worry about it. In fact, don't even get your blood pressure taken.
Right. All right. That's good.
Okay, well, anything else, Jane?
I think I'm good.
Yeah.
I might get going.
Okay, lovely to chat again. Briefly then, I've consulted with Jane and have offered her an explanation for her white coat hypertension. Now, handouts are very helpful to patients to remind them about what we talked about, and they can also show those handouts to their partners. The ones I used are in the handbook, and there's lots of similar ones online to choose from. In terms of a biopsychosocial formulation, a predisposing factor here for Jane might be a quite sensitive SNS, but there may be other factors we are not aware of. Triggering factors seem to include concerns about her grandmother and Jane's ongoing and unconscious fears of having a stroke if her blood pressure is raised. It seems likely she now has a sort of conditioned response to having her blood pressure taken, as it is only in doctors' rooms that her blood pressure goes up. Perpetuating factors probably include the absence of effective reassurance that she doesn't have essential hypertension, so does not have the same risk of stroke as her grandmother. I talked to her about the parasympathetic system as well, and in the long term this may help to reduce the general reactivity of her SNS with respect to headaches and stomach disturbances, and over time it may also help to reduce her presenting symptom. The same sort of approach can be used for many other persistent symptoms, as the SNS is often a contributing factor.
Kia ora. I'm Professor Tony Dowell from Wellington. You've just been watching a consultation where the doctor, the GP, is reassuring a patient that she does not have significant high blood pressure, but what the doctor calls white coat hypertension. The consultation is longer than usual and expected in general practice, as it's intended to demonstrate the underlying principles of diagnosis and treatment of persistent somatic symptoms or bodily stress syndrome and disorder. It's important to understand the way in which the doctor recognizes the overall benign nature of the symptoms and frames them as a physiological rather than a pathological problem. It's also important to recognize that many cases of raised blood pressure that you would see would not fall into this category, but are due to underlying illness or disease. As part of the general inquiry in this consultation, the doctor might also have screened for smoking, alcohol, and recreational drug use as triggers for sympathetic nervous system activity. What are the features that make this consultation effective and provide reassurance to the patient? Well, throughout the consultation, the doctor is listening to the patient's story. This, more than anything else, provides a key to this being good general practice. If in doubt, listen. Be curious about the patient as a person and what might be driving their persistent symptoms. From this listening, we begin to understand the patient's story, and particularly the role of personal context, stress, past events in the generation of her symptoms. One of the key learning points in our approach and management of patients with persistent somatic symptoms and bodily stress is the balance between effective diagnosis and appropriate safety netting versus the importance of not over-investigating, which can engender unnecessary costs and increase anxiety. Here the doctor has an appropriate bob each way. In the first place, he explores potential significant pathology by undertaking a 24-hour BP monitoring. He also places the patient's concern within an appropriate anxiety of significant family history. Following that, the doctor makes what has often been a difficult decision in medicine, to be positive about a non-diagnosis. In this case, telling the patient they don't have hypertension. The doctor then has to provide an alternative explanation for what is happening. Explaining why the patient's blood pressure goes up when checked by the nurse is a positive step, with the doctor using a physiological explanation, the fright, flight, and fight alarm system. This makes sense to the patient, particularly in association with her stomach problems, which could also be linked to intermittent sympathetic nervous system activation. As is commonly found, on further inquiry, the patient has other symptoms which could be described as bodily stress. She reports tension headaches, which are more prominent with work stress situations, and the doctor allows the patient to link those symptoms to the balance that we all have between activity of our sympathetic and parasympathetic nervous systems. An important part of this consultation is the focus on past events and trauma. For some patients, this can be very important, as there is evidence that adverse childhood experiences, or ACEs, can have an impact on physical and mental health throughout life. In this case, the grandmother's stroke is potentially one of the drivers for the white coat blood pressure changes. It's also important to recognise that not all cases will have such linkages to clearly defined past events. Having arrived at a diagnosis, how to help the patient now. In this case, the doctor appropriately asks the patient what they think might work, and there is then a very constructive part of this consultation with the patient themselves identifying exercise, yoga, and being outside in nature as things they think would help, and which also have solid evidence base for activation of the parasympathetic nervous system. Patients are very, very wise, and their stories are often very, very valuable in helping us in our work. So in summary, these sorts of symptoms, intermittently raised blood pressure, stomach upsets, tension headaches, and so on, are common presentations in healthcare where persistent or uncoordinated activation of a physiological response can contribute to the symptoms. Listening to the patient, providing an explanation, and guiding the patient towards appropriate self-care strategies can often lead to a satisfactory outcome. The other videos in this suite are further worked examples of our suggested diagnostic and management approaches for these sorts of patients. For us clinicians, the modern recommendations are to recognize them as such and then to provide physiological rather than pathological explanations, and being very cognizant of the importance of a biopsychosocial approach to the work that we do. While this may take some learning and practice on our part, the outcomes can be very beneficial for these patients.